Okay, next one. This is Bricky, who, when I told this story, he was from Manchester, and his mission in life was obviously come down south to earn some money. He wasn't Andy Vernon. But obviously, and I think also as Le Fire later to inseminate as many young London ladies as he could. And he basically had a history of 5 days of feeling increasingly unwell. He went to his GP a day beforehand, really high temperature. GP said, we've got the flu, go to bed. And the following day he was found moribund. So
A hospital. And when you arrive in the emergency department, he had a low GCS, tachycardic, 155, blood pressure 130 over 50. He had a sort of purpura fulminans type rash, and his limbs were like marble. They were white, pulseless. He could feel at the femorals, but he couldn't feel anything below, and same in the arms. I think this is a picture of him. This is after he got resuscitated, so it was a bit pinker there. Diagnosis?
Yeah. So likely to be meningococcal tears. Okay, so treating the antibiotic, yada. About the hemodynamics, how you going to manage him? I'll just remind you. Well, let me show you later. So these are the standard things: oxygen, glucose is all right, lactate was high, antibiotics, fluid. They reckoned he'd need an IC bed. Not unreasonable. Caused price urge. Okay. Classically, this is actually good, isn't it? 30 or 60 minutes, but yeah, it was making a bed for him. But in the meantime, he's in the emergency department. What are you going to do for monitoring this guy? How much fluid? Do you think he needs fluid?
Yes.
Yeah. And if the blood pressure falls, what are you going to do then? Or if it doesn't recover with fluid? Okay, monitoring. Right. Obviously, you go say, doctor. Pardon? Art line, yeah, that's that. But he blood citizen, it's not going to be the Fed course. Yeah, okay, yeah.
And I central venous.
Yeah, central line. Yes. Fluid, how much? So he's young, biffic, muscular, bricklayer.
I've got some Charlie William and 500 there we go. The big chop was to see what I could.
Yeah. How much? How much do you think he'll leave in the first hour?
Well,
3 to 4 litres, higher, lower.
Clinton, not
Clinton. Give me a number. Come on, put your cards on the table.
maybe a couple of litres.
Any other thoughts, comments? Titrate to CDP. Titrate to CDP. What challenge? Look at the response. Yeah, could do that. Good old-fashioned Harry Arthur. Not disagreeing, a dynamic challenge. Absolutely. So you're agreeing he needs lots of fluid? Okay. I checked before I get that. I said, because they rang and I got component, I said, have given him anything. I get down. They were already giving him fluid, and I said, wait till I get down. Why? Again, grey hair. Horrible word. Experience is these patients with meningococcal sepsis seems to be like common. You often hear of a patient coming to the emergency department, young for helping people, get a lot of fluid, and then they die in the emergency department with pulmonary edema coming up the tube. Anyone seen that? Or heard of it? You do. Thankfully with vaccination it's now much less common, but you've seen cases like that. You're nodding. Yeah, heard of it, yeah. So you do it, and the reason is they had profound myocardial depression. A young bit, not it. And so I took a Doppler down, and that was, sorry, I don't have a picture, unfortunately, but those were the numbers. And tachycardic, now he'd been tubed, his blood pressure was now 105. The CQ was 12. On your own, and my own nerve goes. Stroke from 22 in Leeds Madness. So it should be, in a young, fit, strong man, 100 plus. And the cardiac output takes around 8. Okay, quite a fluid challenge. Regional? Yeah. Got worse. So blood pressure was dropping, stream volume was dropping, cardiac output was dropping. More fluid? No. Hang on, this is 200 mils. Exactly.
Need a monitoring help. Okay, so what would you do now? Fluid, we've all agree fluids probably isn't a good idea. Noradrenaline. Although NORAD just more of a vasoconstrictor than an inotrope, and he's got pretty crappy bench health. You put them in napkins. An inotrope, e.g. Yeah, that's what I did. So, in fact, and I thought Elizabeth GT just said because he was shut down just to try and open up the space, and he might need fluid later, but he needs to sort of get the heart adequately filled, the pumping, and try and improve that circulation. And so, literally within minutes, again, this is anecdote. It's not in textbooks, but these patients get a great big whack of dexamethasone, and you sometimes see literally at the end of the table or at the end of the bed, a blood pressure response, and and I've seen that in a number of patients. I remember one guy, an American tourist who was septic, and literally he was getting huge dose of NORAD, and we were giving boluses, mimicking a big dose of dex, and literally within minutes, not only were we not needing to give the boluses, we were actually reducing the infusion. And he went home to America. He lived a couple of tail. So, and we can't get that big dose, because 60, if I remember right, 6 milligrams of dex is equivalent to 150 of hydrocortisone, if I remember my corrections. And so he had 16, so probably about 500 equivalent. A big dose. And, just anecdote that, I just be impressed with in these, but some wouldn't advocate every patient should take big doses of steroids, but in sort of when they completely lost their vascular reactivity, I anecdotally found it very useful. And literally, you could see within a minute, he was pinking out. He was actually, you could see a little bit more colour in his limbs, and the hemodynamics. There was quite a marked improvement, literally within a few minutes. So we got up to 6.7. And then we did lots of different things at a time, if you get protein C and antithrombin, lots of different things. And that was him 10 days later. Why do I mention women? Because essentially we had lots of, when they heard this guy come in with meningococcal things, lots of young single women with babies coming in saying, well, I did it. What's my baby? And, so that just moved them to the sort of public health people. You need to sort them out. And so we shifted back to Manchester. We're going to be safe, or the women of London would be safer. And it made a full recovery, just lost, apart from losing 2 toes. And he was that shut down. But 2 toes is, a fairly reasonable trade-off for surviving.